Hello and welcome to the igdra Space podcast. My name is Nora Engelbert. Together with Margret Jaeger, I am welcoming you to today's episode for a series on applied anthropology. Margret and I are eager to show experienced team leads, C-levels, and HR representatives the value anthropology brings to the table to help you thrive your business success. Anthropology is about a holistic view on everything that makes us human and on how we as humans perceive and interact with the world. So, anthropology is key for business fields like customer experience, doctor-patient interactions, communication, team building, the intersection of humans and technology like AI, robotics, or any customer interfaces, and for the analysis and differentiation of culture, structure, and technology in organizations and communities. Lean back, listen in, and let yourself be inspired by the stories and insights from our guests here in the igdra space, under the tree of life. Hello and warm welcome to the igdra Space podcast, to our second series on applied anthropology. This time with a new setting focusing on one topic, 5 episodes you can look forward to. And today I'm here, Nora Engelbert, with my co-host, also like me an applied anthropologist, Margret Jaeger. Hello, Margret.
Hi, Nora. Hi, everybody.
I'm so glad, Margret, that we are now in this together and that we have the pleasure to show the world what applied anthropology actually is and what the value lies within our topic. Margret and I met last year via LinkedIn, and we realized we are both anthropologists and we are both working in applying our skills, and realized that as well in business and also in the health sector, the skills and the value of anthropology is not yet very known worldwide, and we want to change exactly this. So, if you are a student of anthropology, please feel welcome to listen in and also contact us if you have more questions, because we will now start giving you more insights on how your skills are of value in different kinds of the real world in jobs out there outside of academia, be it in the office, be it in health sector, be it in corporations or small companies. Your skills are on demand. And also if you are a CEO or work a team lead or in HR or wherever, you have questions on how to do your job better, on how to better reach your customers, on how to better take care of your patients, listen in and see what students of anthropology have to offer for you. That is how we met. And so thanks to Margret, I am now part of the EASA connection. That is the European Association of Social Anthropologists and the subsection of applied anthropology, the Applied Anthropological Network. Margret, that is now how I hand over to you. Please tell us who you are, what you do in the EASA and the AAN, and then we are curious to hear what you brought us today.
Thank you, Nora. So my name is Margret Jaeger. I'm an Austrian medical anthropologist. And after working many years in academia, I left academia and now I work in research only for a local non-profit organization that is part of the city government of Vienna. I am part of the European Association of Social Anthropologists since even before my PhD, so 2008. And it's an association that is for anthropologists who are working in Europe or who were trained in Europe. So our members are more than 3,000 people. And association meets twice a year at the biannual conference that accidentally just happened last week in July. So IASA also has different networks. It's open to everybody. You can join our networks. There are more than 50 now without being a member of IASA. that's very special. So they have easily accessible mailing lists where you put your name on, and also people who are not anthropologists, of course, are invited to join our networks that are thematically focused. And since many years, I'm part of the Medical Anthropology Europe network, and I was also in the board for some time, where people gather who work in the broadest sense about health worldwide. And there is the Applied Anthropology Network that exists also since some years. And the goal of this network, AAN, is to show the world and also show inside anthropology how our knowledge, how our skills can be applied for society's development, for improving services for people, for many other fields than being only a discipline in academia and educating more and more anthropologists.
I'm so happy that we met, Margret, because we share the same interest and the same compassion for exactly this topic. We want to apply what we learned at university, and applied anthropology is, for both of us, the best way to do that. So thank you for being the co-host here in the igdra Space podcast, and for telling us how easily the connections are to be made within EASA, and that we can co-create a lot of things here. So for today, what specific topic is it that you brought with you that our listeners can now learn from, how you apply anthropology in your daily work?
Yeah, so for today, I decided to talk about diversity in healthcare, and I will explain why. So when you think about diversity, and when you Google that, for example, the first thing that comes up is cultural diversity. But there's a very narrow frame. So diversity overall means many different aspects: a person's age, a person's gender, a person's faith, an educational level, income, people's political opinion, if a person has a disability or not, many aspects. And if you hear the word diversity in healthcare, it's something that I observed in the last 15 years since I am working in healthcare as an anthropologist, is the patients or clients diversity. Very much often also coming up with, and this diversity aspect troubles us in our daily routines. And to understand, you need to know a little bit how medicine, how healthcare works very often. So the standard patient, a doctor, a medical student learns about is a male, middle-aged, quite well-educated person. In the best case, not chronically sick, having some health problem, showing up at the doctor's office, receiving some medication for that or a surgery that's needed, and the problem is solved.
Yeah, that sounds pretty easy.
Yeah, but half of the world's population is female. And there is even more gender diversity out there. So this is part of the problem, the history of medicine. And then if you think about how healthcare systems work, and this is like in theory on the meta level, we know all about the daily troubles of healthcare systems, lack of financial resources, lack of staff. But on a meta level, you also can say the health system is not designed very often in many places for chronically sick people, for children and youth, for example, for elderly people with multiple chronic diseases. It's complex. We are a complex human being, right? And the health system and also those who finance or finance health systems want quick solutions.
So you are saying that one value applied anthropology brings to the table is an effective tool set of managing complexity?
Yes. And why this is? Because an anthropologist has a holistic view on people. So we perceive every person with the person's history, like also the family's history. We see the person with all the diverse aspects of age, of gender, of where the person stands today. And we're also asking and able to look into the future with the person. And we take in relation to context around the person. So the very personal setting, but also then the local, the regional focus, for example, in which country lives the person, which health system works there, how does it work? Like there is overall more often structural issues that influence not only a person's personal well-being, but also how the person uses a healthcare system or not, and how are the outcomes. And this is the strength of anthropology, being able to include a holistic view and having the tools like observation, interviewing, mapping, being in a space where health providers work, having an outsider eye to observe and question and help to evaluate and then improve or plan improvements for better healthcare services.
That sounds wonderful. Let me summarize it in my words and please correct me if I'm wrong or if you have something to add or amend. So you're saying what we learn in anthropology is how someone who is not us perceives the world. So you are, as applied anthropologists in the health sector, your job is to look at the system on the different levels, from specific local here to the community, to the country level, to the regional level, and say, okay, that is how the system works. And I walk through the system now, one day in the shoes of this person, one day in the shoes of this person, and then you realize how different the system is felt and perceived by these different kinds of persons.
Exactly. And that is important. I don't only walk in the shoes of a patient or a client, but it's also of the provider. Because this is very often forgotten when we talk about diversity in healthcare. That is, there is a health professional with the person's own diversity aspect that influence later a doctor-patient communication, relationship, a therapeutic patient relationship, even quality managers who talk to people who access healthcare services. So it's much more than the patient's diversity that influences how is the daily routine, but it's also all others involved and also on a meta level, because our society, our local context matters every day when you provide healthcare services.
Very good. So when I was still at university and also doing my doctoral research on migration and aging in the healthcare sector and the care sector for the elderly, was exactly these aspects I wanted to focus on in 2013 when I finished my PhD. My aim was to apply what I gathered as research results to improve the entire system and get people connected to each other and make them realize, what are you talking about here? What can be changed on the system level to have people in the structural level, to have people in there to move more smooth through the system, to have a better flow within the system and feel comfortable and relaxed, and with that get healthier anyway. But also understanding, okay, where are we now talking about cultural or mindset differences? And that is something that is currently very much debated in the business context, in the organizational and enterprise development context, that people say, okay, we need to change and people need to change their mindsets and their culture. And then you say, yes, they do sometimes. We all do. But what you are now complaining about actually is not a mindset or culture topic, but it's a structural topic. So that you're saying it is the same in the health sector, right?
Exactly. It's a question of structures and a question of structural competency that, for example, a health professional already has acquired or can develop. Because it's very often not the case that it's the patient's culture that stops the person from doing this or not doing that. But it's structures like not having enough income to buy healthy fruits and vegetable, or not having near your house infrastructure, of being able to buy those things, having mobility issues that trouble a person to move for longer distances for healthy grocery shopping.
So what would you say is the most crucial or one of the most crucial mistake that could happen, or the most impactful negative consequence that could happen when people in the health sector identify something as a cultural or mindset problem when in fact it is a structural problem, or the other way around?
Yes. So when something is blamed to be a cultural problem, it's handed back to the patient very often, and it doesn't get any solution.
So it's a responsibility issue.
It's about responsibility of the health professional that has to be able to look carefully and structurally at its best. What's the underlying thing that stops a person from doing A or B or not doing A or B? Because giving it back to the patient doesn't solve the problem. Let's use the most simplest issue that comes up whenever I talk to a health professional or a manager in healthcare. It's the language barrier. In my home country, we speak German as main language. German is not an overall easy language. And people who come newly here need some time to learn it on a level that they are able to communicate in health services about their needs. And very much often, there is this blaming on the patient. He or she doesn't speak well enough German. And then there is not enough time in the system. It's also blamed for that at the end, somebody leaves the doctor's office or even hospital and not having the health problem solved, or even the health deteriorates over time. And when I hear these problems, I innerly start smiling, because today in the 21st century, there's a lot of technology that helps us, or that could help us, to easily get over these barriers. So people think of, we need an in-house interpreter. This is expensive and we don't have money for this. Yeah, of course, in-house interpreters are the highest standard. And that's wonderful. And that's very often needed when you have a very sensitive topic or a sick child that's going to die soon and somebody needs to talk with the parents. But there is video interpretation, for example, which is much cheaper, much easier to access. There is telephone interpretation, but there is much more today. You can use pictograms to communicate quickly about something, You just need to be aware that the person understands the symbols. So there is kind of an international thing of who understands which symbol how. There is apps, as you know, nowadays. There's also the possibility, if, for example, a hospital is willing to invest, do a small study, okay, which languages do my employees speak? And then ask these bilingual, trilingual employees, would you be willing to assist as interpreters? And if they say yes, offer them a training course, because interpreting in healthcare is not helping somebody at the supermarket's cash desk to get something solved. It's very specific. There is ethical questions involved. There is technical language questions involved. There is doctor-patient-interpreter relationship involved. And as an employer, from an anthropological point of view, you have to be respectful and careful that your employees do not get hurt in this process as well, like second trauma, and also are not forced to work as interpreters. Because this is often the case today. There is a patient incoming in your ward and speaks Russian, and there is a person who has a background from Russia or from any other Russian-speaking country and is called, come over, please, and help me. And there is not even really consent asking for that. And this doesn't make it a good interpretation situation, and also may involve unsuccessful interpretation and a going onward journey for the patient, but also for the interpreter who is not satisfied, who did not feel comfortable, and also the medical provider who probably could feel that, okay, this was not ideal. But it's in daily routines of many, many hospitals, the way how their problem of a language barrier is solved.
It sounds important, and I like so much that you have shown now how anthropologists, and especially applied anthropology, is pragmatic. So for our audience, I would like to summarize what I take now from your story and from your topic on diversity in health sector, what anthropology actually brings to the table. So what I have heard is applied anthropology, because of its holistic approach, can have a better diagnosis, really saying if something is in structure or culture, and with that goes down the right path and finds the right remedy, let's say, for an issue. Then it's pragmatic, as I just said. You're saying, yes, of course, having the right interpreter is the best way, but there is technology. Let's use it. And also the fourth is that you have shown us again, all our human interactions is in context, and that anthropologists really take every little single thing and put it into context, into this holistic view, finding pragmatic solutions to it, and understand that while having the holistic approach, everything is interaction, is communication. So it's already a kind of translation an applied anthropologist does for every situation, the context, and the pragmatic solution. That's what I got from what you have said. Would you agree to that?
Absolutely. It's about making the right questions or consulting others to make the right questions in the right situations. And creating awareness about context. It's not only offering information or knowledge, but skilling up people with anthropological skills as well, to help them to offer, in our case, good healthcare services. But what happens, and there are many anthropological studies that show that, if you are able to improve doctor-patient relationship, at the end, you don't have only a satisfied patient, but also a satisfied provider. And this is important for our all well-being, We need to think holistically and say, it's not only about providing services for somebody, but from the employer's side is also providing a healthy, safe workspace for the employees, for the health professionals, to be able to offer good services.
Wonderful. I take that as a great last word on our today's podcast. So thank you, Margret, again for being the co-host of this podcast series and for having the start and telling our audience who you are and how you work.
Thank you, Nora. I'm looking forward to our series. Bye.
Dear audience, thank you for having listened in to our first episode. What we heard from Margret is that applied anthropology brings value to consultancy services in different sectors, today healthcare, and project work beyond the actual aspect of diversity, as we as applied anthropologists connect and train people to be able to co-create their changes themselves. In the next episodes, we listen to further applied anthropologists and their fields of work and how they apply their skills. Thank you. Bye. This podcast is produced in collaboration with the Applied Anthropology Network of the European Association of Social Anthropologists. Thank you for listening in and being with us today. If you wish to learn more about us or our guests, please check on the igdra Space website, www.igdra-space.org/en, or contact us directly via info@igdra-space.org. We are happy to answer your questions and to hear your thoughts on the value anthropology has or could have for your daily work. Looking forward to sitting with you again next episode. in the igdra space under the tree of life.